Hello, I'm Dr. Nathan Faulkner, an orthopedic surgeon that specializes in sports medicine, arthroscopy, and shoulder replacements.
And I'm Cara Cohn, his physician assistant.
We're the team that will be taking care of you, and today we will be demonstrating important components of your care. After your nerve block has worn off, we would like you to start doing pendulum exercises 3 times a day, which we're going to demonstrate now. To effectively do the pendulum exercises, you should find something to lean on like a table or a chair. Then you bend over at 90 degrees at the waist and let your arm just dangle in front of you, kind of like an elephant trunk. Then you start going front and back and do that 10 to 15 times. Then you go side to side, again 10 to 15 times. Go in a circle clockwise and then counterclockwise. Notice how Cara is not swinging her body or making very large movements. She's simply letting her arm dangle in front of her with nice, gentle movements. So after surgery, you will have a nerve block. And once your nerve block has worn off and you have full control of your arm again, we want you to remove the sling 3 times a day to do some specific exercises that we're going to demonstrate now. Firstly, we want to make sure you're doing elbow range of motion. So you should fully extend and fully bend the elbow 10 times, 3 times a day. We would also like you to flex and extend your wrist 10 times, 3 times a day, and use the exercise ball to squeeze that several times a day. Again, that helps promote blood flow, which reduces swelling in your arm. At 6 weeks, we will most likely have you discontinue the use of your sling, and we'll introduce some new exercises to help work on your range of motion that we will demonstrate in this video segment. First, we would like to have you do wall climbs. So face the wall and put your hand in a comfortable position on the wall, and then gradually start to climb up the wall. We want you to climb up the wall until you start to feel some pain. At that point, hold that stretch for 10 seconds, and then you can relax and come back down the wall. We want you to do this 10 times, 3 times a day. In the later stages of your stretching, as you climb up the wall, you will then try to walk towards the wall to get that last little bit of stretch. Then we would like you to do wall climbs out to the side. Again, start with your hand in a comfortable position and climb up the wall, and you climb until it starts to hurt. Hold it for 10 seconds. And then as you progress, you can climb further up the wall and walk towards the wall to get that last little bit of stretch. To work on internal rotation, you can take off one of the straps from your sling or even use a rolled up towel. And we'll demonstrate how to stretch your arm in internal rotation now. So what you want to do is use your good arm and drop the strap behind your back to your operative extremity. You grab it with that hand and then use your good arm to pull the strap or the towel up. And this stretches it in internal rotation. Again, you want to go until you feel some pain. Try and hold it like that for 10 seconds, and then you can relax and do it again. And you do that 10 times, 3 times a day to work on internal rotation. We will now be demonstrating how to work on external rotation. The best way to do that is to take a kitchen towel and roll it up and put that under your armpit. We'll explain why that's important in just a minute. Once that is in position, then we want you to hold your arm perpendicular to your body and then find a door jamb or a corner of a wall to provide some pressure against your hand. Then you can turn away from your arm to get a good external rotation stretch. Notice how her elbow is staying close to her body. The reason why we have you put a towel underneath your armpit is because when people can't externally rotate, the tendency is to abduct your arm to make up for that. And if you have that towel underneath your armpit and you're holding your arm against your body, you'll be less likely to raise up your elbow and lose the ability to externally rotate. Again, this is a stretch that we want you to do 10 times, 3 times a day.